Okay, we might make a start now. Okay, good morning everyone and welcome to the Building Trust and Engaging Multicultural Communities in Injury Prevention Programs and Services webinar. My name is Balana and I'm the Injury Prevention Officer for Workforce Engagement here at Injury Matters. Today we have guest speaker Henrietta Podgorska from Umbrella Multicultural Community Care Services who will be presenting this webinar. Before we begin, please let me acknowledge the Whadjuk Noongar people, who are the traditional custodians of the land on which Injury Matters work, and recognise Aboriginal and Torres Strait Islander peoples' continuing connection to the land, waters and community across Western Australia and Australia. I would also like to acknowledge the traditional custodians of the land in which you are joining in from today. Before we start, I'd like to go over a few housekeeping points. Please make sure your microphone is muted. This will allow all attendees to hear clearly. We would love to hear your questions, so we strongly encourage you to please send them through the chat box throughout the presentation and we'll go through them at the end. If you have more than one person in the room with you listening to today's webinar, we would appreciate it if you could please let us know how many people are in the room with you via the chat tab. If you face any technical issues during the presentation, please write them in the chat box and we will do our best to help you. I have Joe here helping me today. We will also have a QR code at the end of this presentation so you can complete a short evaluation on this webinar. If you could keep that in the back of your mind, that would be great. To protect attendee and presenter privacy and data, Injury Matters prohibits the use of artificial intelligence-driven systems and technologies, such as automated note-taking, recording or transcription tools during or following this webinar. Thank you for your cooperation. So, just about Injury Matters. At Injury Matters, our vision is for safer people and places. We aim to prevent and reduce the impact of injury within the Western Australian community and support those who have been affected by injury. Our three programs aim to raise awareness of injury risks, consequences and solutions, prevent injuries through a range of education and support programs, and to support the recovery of people, families and communities impacted by injury and trauma. Together, we find and share injury prevention, recovery and policy solutions that keep people safer and healthier. Today's webinar is brought to you by the No Injury program provided by Injury Matters and funded by the WA Department of Health. The No Injury program provides ongoing networking, training and development opportunities to support the prevention of injury in WA. Injury is a significant public health issue in WA. More than 4 members of the WA community die due to an injury-related incident each day. In 2023, injury was the leading cause of death for Western Australians aged 15 to 44 years and the third leading cause of death for the whole population. The leading causes of these fatalities were falls, intentional self-harm and poisoning-related incidences. Western Australia has a rapidly increasing multicultural population, made up of a variety of different communities, each with their own unique identity and experiences. WA has the largest proportion of residents born outside of Australia, where 38% of Western Australians were born overseas. Cultural, social and psychological impacts on health may increase the prevalence of injury among multicultural communities. That is why effective strategies are needed to prevent injuries, ones that engage and build trust amongst the community. I would now like to introduce Henrietta Podgorska. Henrietta has recently stepped into the role of CEO at Umbrella Multicultural Community Care Services, marking a significant milestone in her career dedicated to serving the community. With over 10 years of experience in the aged care sector, Henrietta has built a notable expertise in fostering engagement and improving accessibility within culturally and linguistically diverse and LGBTIQ+ communities. Her journey includes impactful work in both government and not-for-profit sectors, where she has been instrumental in engaging in enhancing service delivery and supporting for minority populations. I would now like to pass it on to you, Henrietta.
Thank you so much for having me today. So let me just bring up my slides in a second. So, jó reggelt kívánok mindenkinek, Henrietta vagyok, és nagyon szépen köszönöm, hogy itt lehetek ma önökkel. Good morning, everyone. My name is Henrietta, and it's an honor to greet you on my mother tongue Hungarian, and thank you again for Injury Matters for having me today with this presentation. First, I also would like to acknowledge the Vodok and the Binjari people of the Noongar Nation as the traditional custodians of the land on which our services are based here in Borlo, Perth, and pay my respect to the elders past, present, and emerging. We also acknowledge the elders of the culturally linguistically diverse and the LGBTIQ plus communities who act as an inspiration behind our mission and vision. A little bit about Umbrella. So I've been around for 25 years and I have been delivering services in the community under the home care services. And we jumped through from HEC to now home care packages and obviously preparing for the support and home program. But we also had a lot of outreach projects, especially since I started 10 years ago, when we actually going into the communities and working with them to amplify their language, their voices as well as their needs, so we can inform and educate the systems and organizations to do better or to do more to address some of the gaps and needs in the communities. We are very diverse. We have over 1,000 clients from 72 countries and we speak 61 languages. So we're very diverse and we always love to see new cultures emerging and celebrating within Umbrella. And yes, we want to improve system for all. So that's our big mission. So let's set the scene a little bit, and thank you so much for a little bit of background on data, because data is important for me as well as the story that tells. 1/3 of Western Australians are born overseas, and 60% of the population consists of first and second generation. So we have quite a big number of people who came from overseas, and even if they came from an English-speaking country, that they may be the indigenous to that land, or they had other languages that have been spoken, and culturally they may be also different to what you have here in Australia. So there is a lot of diversity in Western Australia. We speak 249 languages, we represent 221 countries, and we have 130 different religious faiths, which is quite diverse. So when you look at this is not just diversity, this is a superpower. But we need to learn how to harvest this as well as acknowledge it in a way that is meaningful and not just ticking some of those compliance boxes that we often do. A little bit about seniors. So obviously we're working with seniors, and injury prevention is quite big from our end, because most of the time we lose our clients to residential care or to passing away because something happened at home, and most of them we can see tracking back, it's about falls, especially increasing in unwitnessed falls, which meaning our staff were not there, the client just had an accident, it's increasing. So we're definitely looking at more how we can prevent and better communication between our frontline and our care partners as well. But in generally, what we are seeing is that seniors from multicultural background are rapidly aging, even more than their mainstream counterparts, as well as they are the 85 plus cohort. We have 90% of our seniors back in metro, so we're actually leaking multiculturalism and wisdom from the regions back to Perth. They 29 or nearly 30% of them do not speak English well or at all, and that number is increasing with every census. Females, especially at risk, so women from multicultural backgrounds are least likely to have right level of education to even be literate in their own language, as well as they're more likely than not that they will need support compared to their male counterparts or their mainstream counterparts. So you can see that in there. So we're building a very complex pictures where they may need more assistance, but their capacity to communicate their needs are diminished because either never had the opportunity to be literate in their language or in English, as well as we have financial issues. So that also can prevent people to access services on time. So why this is important? Well, because injury risk, especially multicultural communities, have very strong social determinants. Access to housing, income, education, and safe environment can be a really good prevention when it comes to injury. And unfortunately, what we are seeing coming through, especially with women who often are not left alone after their partner passed away or the kids left, went back to the country or went to East Coast to study or to work, they're left alone to navigate sometimes very complex systems, and they're not speaking out when they have issues, when they feel dizzy. So there's a lot of work that needs to be done, often and not. A lot of those protective factors also not around them. They may not have strong families, although that is going to be even more issues because in 1999, we had a profound change when it comes to how this country manages visa. Before that, it was mostly family reunification, meaning that's why you have lots of big Italian family, big Polish family. That's why they have the cousins, the nephews, the nieces all here. But at 99, the Austrian government made the change to skill-based visa migration. That's why you're going to see communities aging here, having less family support, having less generational wealth because it's family units or individuals that are migrating here. So they are even going to be even more vulnerable going forward in 20, 30 years. We're going to see a very different cohort and clientele, and the protective factors are diminishing by the day because they are not coming with big numbers that can support them in later in life. And of course, this is why it's important that we have strategies in build, so make it a core business to have strategies around preventing issues when it comes to especially falls, because we're going to see the numbers are increasing as well as the protective factors are decreasing. So we're going to see more issues in the multicultural communities. So what I suggest, and again, I'm trying to get through quickly because I want to have a good discussion and your experience. I want to hear what you're doing in the community and how we can, is there's any good discussion we can have here today. But if a few things that I can comment, and please take a screenshot with your phone or on your on your phone, computer. These are the questions that I would love you to ask yourself and your organization going forward. How do you know who you are servicing? Do you know which environment you are sitting in? Because there are multicultural ecosystems all across WA and Perth. Where do you sit? What are, I had organizations saying, I don't know, I never heard, I never interacted. Where is your head office? In Mirrabooka? And I'm like, haven't you just walk across to the Mirrabooka shopping center? Like, you need to know where you are location wise, but as well as who are you engaging with, as well as what information you're collecting and what do you do about it. We are really, really good again to make it a compliance issue. So you put it into the, survey of, so where are you from, what language you speak, what do you do with that information? What do you do with it? And often than not, we do nothing with it. And again, and what I wanted to say in the beginning, that we have a superpower, which we're not really acknowledging, is because that could be driving a lot of your innovations as well. But again, I get into that in a second. So language. Not the language you speak, the language of our advocacy, of our engagement, that needs to change. I am a very big advocate and have been advocating for years now. The way we are looking at community engagement is wrong because we're using the wrong language. But let me get into that, okay? It's not like I invented this. It's just literally the amount of engagement, the sheer engagement I have been doing with the communities. I realized that, hang on, it's not them, it's me. And that really helped me to open up a lot of other venues to talk about these issues. So first of all, you may have seen these words around: cold, new and emerging, multicultural. These are good definitions and they're important definitions, but often than not, they are not well defined, and especially when it comes to your organizational level. So if I ask you what CALD means to you, and you say, well, our official definition is this, that's really, really great. That's going to be different from the next organization because technically we do not have an official government level, national level wording for CALD. It came from the ASB, so ABS, the Austrian Bureau of Statistics, and it changed from non-English speaking to CALD. But the reality is, if you Google CALD, you're going to have 50 million different version of it. So you need to be aware of how you're addressing and what does that mean to you. It's important to know that CALD is a debated context, but I don't want you to just remove it as is, because I had issues with national strategies that go for like 10 years. They wanted to do the right thing and they just scrapped CALD because they heard that the communities are not happy with it. Yes, we are not happy with it because it does not identify the different needs and levels within the different organizations. I'm a well-educated Eastern European white woman who speaks good English. I'm fine. Okay, but a lot of the other, but I'm still CALD. But a lot of my other counterparts who may look different to me or may have a different journey into this country or may have a different level of education, now they may have a very different experience. But CALD doesn't really recognizes that. It's just like all of you together and let's be happy about it. So Problem with that is, and again, please keep using this term because at the moment we haven't had the space and breathing space to have a better conversation about what else we can use. The other thing that people often use is new and emerging. What happened because of the inefficiencies of CALD, meaning they're not really differentiating between the different needs of the groups, new and emerging become a synonym to everybody who is not European. That's not a good thing again, because within the new and emerging communities, we meant to address those who most at needs. Some communities new and emerging, but they have thousands of members, millions of dollars worth of assets. And then you have new and emerging communities who are refugee backgrounds mostly, and they're just happy they have a plastic chair in someone's backyard to sit down. Who do you think will have better opportunities to communicate their needs to you? Well, not the one with the plastic chair. So this is why I'm saying really make sure that using these definitions, don't remove them, but just to make sure that you are aware of what you're communicating with these languages, because it can actually really misfire and lead you down to a path of non-engagement with some of these communities, or you're not giving them the space to engage because they just don't know that they can. They don't know how to articulate their needs. Now, I had many few webinars in my life, and often and not, I'm brought in as an expert to make commentary on what's happening and what's not happening. And this didn't happen to me, but I really picked it up and I asked if we can talk about this from my other community advocates. We have a few of us, and we share some of that. She attended a meeting where it was a high-level one with the HK department, where they're discussing, about multicultural. That was the aim of discussing some of the diversity and inclusion issues. And when she arrived, the first question that was put into her face was, so what does cultural appropriate services mean to you? After 10 years of us screaming at everything, the Royal Commission, the diversity framework, we are still asking this question. The problem is when you do not have well-designed definitions, you creating uncertainties, as well as everybody's going to do their own to the best of their abilities. It's not that organizations don't want to do cultural appropriate services. It's just if they don't have the tool, the means, and the experience, we are going to see very different outcomes for them and for their clients. And that's a big problem, for example, with the new Aged Care Act. It uses very big words like person-centered care, cultural appropriate services, cultural safe services, trauma-informed. But one of my criticism is because it's not defined, it's going to lead the providers to interpret it themselves, while also putting on the pressure, because that's in the obligations and the rights, that the client needs to clearly communicate, because it's an individual experience. They should be able to tell the provider what they want. Well, these people have been never asked by the system. They don't know necessarily internalizing this. So when we have these ambiguity, big words used in communication, but you're not defining what you mean by that, now you're creating nothing else but uncertainty, confusion, possible disengagement, as well as a very different way of addressing these needs. And it's not going to be suiting everybody at the time of their time. So please define the terminologies that you're using. You're not defining it, ambiguity shifts the burden to the clients and to the providers, and then just hope for the best. Communities are still being asked this stuff in 2025 is not okay. And I'm going to get into that in a second as well. Why? And risk of misinterpretation, which is just continually one of our biggest concerns when it comes to this system. So one of the other words that I used, and again, I want to shift your mindset on this, is what does hard to reach means? When I say, oh, they are so hard to reach, Henny, by who? By why? Why they hard to reach? Other than a very small percentage of our society, everybody has interaction with us. They go to the bank, they have a bank account, they study, they have a phone, they have bills to pay, they have a pharmacist, they have a GP, they may have a car, they may use transport. There's so many opportunities to engage with people, so they are not hard to reach at all. Now, I do have to acknowledge that often and not when it comes to this, they are hard to reach comes down to the barriers of the clients or the communities you're trying to engage. And these are not to be dismissed. This is very important. But I think we talked about this again and again. What are their barriers? And every time my team is trying to have some discussion, and I said, no, we had enough this discussion. We know they have lack of confidence. residents, maybe language, maybe culture, maybe transport, over consultation. So asking us every single time what is cultural appropriate services mean to you, instead of discussing that's what means for you, what means for me. Over consultation can also diminish. People don't want to be telling their stories again just to have a system or an organization not responding to their needs, or the combination of any of these. So I don't think anything is new for you hopefully from this side. But what often is new for people is looking at their own barriers, because you don't have unlimited time. You don't have unlimited resources. You don't have unlimited teams. You don't have unlimited policies and letting you do whatever you want. You may have a management who does not support any of this because they think multiculturalism is just a compliance issue. And when it's too hard to deal with, and just put it in a back burner. People are gatekeeping, budget restrictions. Your level of cultural awareness may be high, but is your organizations as well? Do you just go back and feel like, well, I want to do this, I know this is the right thing to do, but I feel like my manager and the policies of the organizations are not making this happening? That's when you have a disengagement between the cultural awareness of you and the cultural awareness of your organization as a whole, and that also can create frictions. So all of these issues are creating a barrier of its own, but it's coming from you. The good news is, though, once you are aware of this, and again, you can assess it from your experience as you stand today, how far that is going, you can actually change the narrative, because nobody's beyond reach. Once you know what is your reach, so don't worry, we know some of the things that the communities are facing with, but currently you have a reach. Within that, you have your staff who may be from that particular cohort. You may have volunteers, you may already reaching some of those groups. So you already have a reach. And owning that reach helps you to navigate. What can you do to push that reach to make sure that you reach more communities? Is it that you need to have a new budget? Can you apply to Lottery West? You need another staff member. You need to change some of the policies. You need to make sure that your organization have the cultural awareness that you need in order to deliver this. Or you can identify which communities, and this is when data comes in. You can reach out to those or those community groups, ethnic community groups, and say, look, this is as far as I can go. I know my barriers. This is as far as I go. How can we get closer? So that's when that partnership with the communities and trust start building, because when they see that you can be in that vulnerable position, acknowledging your own issues when it comes to this engagement, but the common goal is the same, to educate them or to support them to make sure that injury prevention is working in that community, and they have, we increasing the protective factors as we go forward, that you can actually connect with them. And that's the gold nugget when it comes to community engagement. So language does matter. Please make sure when you use terminologies, you explain that, or at least have some way that your staff specially knows what they mean by that. Don't just use big words, because that, first of all, means nothing for the communities, and second of all, can create additional issues. And they are not hard to reach. They just beyond your reach right now. And hopefully today, after this workshop, you get a couple of nuggets that you can use to go out and push your boundaries, or push that out a bit more, or get communities to engage with you. So let's dig into the community engagement bit. And again, it's really important to acknowledge first that often than not, community engagement with multicultural communities are only about translating and interpreting. And that's a little bit of a problem, but I'm getting into it more. First of all, it's still very tokenistic. They just look at a data and say, yep, that's it. They're not looking at English language usage. Still, the biggest group that needs translated material based on the age group as well as the English proficiency is still Italians. There are around 3,000 Italians in Perth, just in Perth, who do not speak English well. Compared to the rest of them, that's very, very, very minor. But again, remember, Italian community came here a bit earlier, so they have a bigger group. They're more likely than not able to support them, while we have very vulnerable groups in other new and emerging communities who came here as refugees in the last 20, 30 years. Yeah. So this is where we need to, data is so important to know who are you engaging with, assess your multicultural ecosystem and how are you connecting into that. Also, no funding available, and it's not a cheap endeavor to translate to anything. And why I and I'm going to get into AI in a second, AI can play a good role. This also can be a backfiring. But let me get into that. So I'm not fully dismissing it. I'm just saying that we need to make sure that we're using it at the right time for the right reason. Okay, not as a giveaway card that I don't have to spend thousands of dollars on translate materials. But again, if you're using your translated materials for the right way and planning for it, you are not wasting money. You are investing into your communities. Now, also, the problem with when it comes to engagement and translation interpreting is how our language and culture framed in every single thing that we do, regardless of where you're from, if you are in the department, if you are in working for the government, working for a non-for-profit, working for for-profit. The thing is that you have a policy, a framework that says the following. We need to break down language and cultural barriers. Our language and culture is a barrier. How empowering. So empowering. Very empowering. And be surprised again and again and again, putting it into framework and legislations that we need to break down these barriers, language and culture. And we're surprised that it's just landing absolutely with nobody and nothing. Because we're using the tool of translation and interpreting. And often or not, these conversations look like this when we're inviting them to talk about outcomes and better outcomes for our communities, when we want to advocate for visibility for our needs and for our clients. Often they're not these people who think that they need to break down something for us. They come in and says, Henrietta, but we translated this to 10 languages. What do you need? But they can call these for free. What do you need? And again, we are surprising that this goes absolutely nowhere with those communities. The problem is that translation and interpreting is indeed a tool, but it's not your outcome, it's not your plan, it's not your strategy, it's just a tool. And again, same with the beyond reach versus out of reach, beyond your reach versus hard to reach. This is another thing that I would love the industry to shift, because translation interpreting is a tool. Everything else matters what you do around that, because when it comes to this tool, yes, 100%, you can use it to destroy when you don't have a strategy to how to know which language to translate, or don't know how to distribute the translated materials later on and it's dusting on your shelf because no one is reading. Or you can use translation and interpreting to build, because language is not a barrier to be broken down. Language is a bridge to build together, to come across, and to connect with each other on a very human level. So before I go into the case study that I wanted to show you today, I just wanted to show you this picture because I think it's so important to shift our mindset when it comes to anything to do cultural engagement, your strategies, your inclusion plans, and your policies that may or may not preventing you to engage. One of the problem is that when I see websites having, all the different beautiful diverse faces, it's really, really great. It's some indication that you thought about at least being somewhat inclusive. But these pictures are from Umbrella. This is our day-to-day activities with our clients and celebrating their cultures and languages every 12 months a year. But this is not your outcome. This is not your community engagement plan. This is not what you should be aiming for. Everything else around it, this is your reward. This is your reward if you do engagement right, if you know your barriers, if you have policies that are enabling instead of destroying cultural and language, if you realize that language and translation interpreting is a tool. All of these things can lead you to this, but this is your reward. Everything you do, whatever you do, everything before and you do everything after is what should be mattering, because this will come. Once you start doing the right thing, or once you start implementing some of those changes and strategies, you will have this naturally come up and pop up and engage with you. And I think that's the beautiful thing. We don't make any effort on this. This is just what Umbrella does, but we have those policies and language and engagement in place because that we were built by the ethnic communities. Yeah? And this is why we're happy to share, because I think this is beautiful and I absolutely love these pictures. So, case study. Again, I just would like to acknowledge this is not a case study from injury prevention, but I just wanted to highlight how does it looks like when you use interpreting translation as a tool to build versus destroying, and some of the interesting outcomes. Please feel free to implement or give me a call. We can have a chat. Injury Matters knows it as well. I think this is really great outcomes. So we partnered with Dementia Australia a couple of years ago. They are fantastic at engaging with communities. They have one of the highest level of translated materials, 37 languages, and every language has like 15 pages of translated materials. Like, it was really, really great. But what they saw, the uptake of the information was either difficult to track or not really there. So we said, okay, can we do something different here? They were very innovative, and I love my innovative partners. And said, look, what can we do? I wanted to bring them, because they have one of the best workshops that I have ever seen, to get all the communities to understand about dementia. But then I said, the other 45 minutes, I want the communities to talk. So let's do 45 minutes translating what it means from Australian English, which is often monolingual and monocultural understanding of certain things, to another language and culture, and then revert it back and ask the communities to talk while they talk about this issue in their language and translate it back to English. So that's how we build our bridge from one end and to the other. And how did we meet in the middle was an amazing experience. So first we talked about, obviously, dementia. One of the problem is when we're translating things from English to another language is that, again, coming from a monolingual, monocultural understanding. And one of the big examples is actually aged care itself. Aged care, if you translate it as is to another language, often means an institutionalization, where you have these rundown places with often bars on the window, where only unwanted people go. So when you just translate it, just cold translate the whole thing, people went like, oh, I don't know. I made my parents cry because they thought I'm, chucking away thousands of dollars worth of studying. My colleague had to say that she's an Italian interpreter because her mom was crying. And one of my other colleagues from South America, her mom said to her that you are no better than a factory worker. That's how bad the perception of aged care is in other languages. When we know that aged care is what it is in Australia, I absolutely love working in it. I think it's a fun industry. We give so much back, and we receive so much from our clients. It's a very different experience. We had to be mindful. So the first 45 minutes, we didn't really focus on translating the word dementia per se. We translated everything around it. So how does the disease behave? What are the different aspects of it? What are the different prevention? So we worked down to the common understanding of everybody in their language to make sure that we are bring everybody up in to have the second part of the conversation. Now, the second part of the conversation was actually inspired by a few of my interaction with multicultural communities and how they make sense of the world, but also when they're trying to give us a little bit of a hint of how their culture works. So one day around Easter time, we were sitting around having our lunch and umbrella, and we're asking our colleagues, so what do you do for Easter in your country? And most of them, it's the water, it's the flowers, it's the eggs, and so forth. Then came to my Easter Slovakian colleague, and she goes, yeah, so we get the young willow branches and we make it into a big stick. And then, you can do it at home, but also you can buy it now in the shop. So you can see the lint bunny at the background. And we were like, cool, so what do you do with this stick? And she said, well, we give it to men so they can, on Monday, Easter morning, they can chase women down the road and whip them. Now, when she first said it, obviously our faces were like, excuse me, you did what now? And obviously for her was, well, our first reaction was very interesting. But then also she realized, well, this didn't sounded too good in English. And we were like, yeah, it did not. So again, bringing out some of your cultures and translating it to another one, and may it be English in this scenario, helps people to understand what kind of shifts they need to make when it comes to their perception and understanding and myth around certain issues. So we asked 3 questions only in the second part of this. One of them was, what is the actual word for dementia? Then how they talk about the disease and the people experiencing the disease, and then how they seek help, which is an important part of community engagement. Now, I'm only going to talk about the first one, which was about the word dementia. So it was very clear that after doing 20 plus communities that we have 3 very clear differentiation. One that had the word for dementia. The second one, they had a word for dementia that sounded like dementia, but they also had another word. And the differentiation happened because of the different way of the countries are dealing with this disease. So they either had a different word because it's only city folks that use dementia, or medical professionals that use dementia, or the younger generation who is much more well educated and speaks better English, and they also well traveled, knows about the disease. So dementia is better, they understand it, but the parents' generation still referring back to a derogatory term that is not necessarily a positive, it's not a positive word in all scenarios, actually. And then there was communities that were completely absent of any word in regards to dementia and only used the derogatory term to describe the condition. So these communities, and especially two of them, were very shocking for us because they have a legendary values when it comes to their elders and caring for the elders. And if I ever have to fight a word war for my community, I will put them first because they are the avengers of looking after and loving their elders, and just sheer volume that their values are very well known. And that too was the Arabic speaking and the Hindi speaking communities. What was very interesting is that when we asked them to translate it to us and have a discussion about it, you see a very sharp pause, like with my Eastern European colleague, because that hit their value system of loving the elders, and they were like, all right, that doesn't sound good. We can't call our parents mad. This is not okay. So it was very interesting shift of how they're realizing in English that their value system is not matching with the way that their language talks about this disease. And that was like the incredible to witness that level of empowerment, because I didn't have to do anything. We just stepped back with the Dementia Australia guys, and the community itself started to discuss of what they're going to do, what are the shifts that needed. The help-seeking behavior have increased. They actually wanted more. They wanted more workshop on dementia. It was just like one of those things I never see. Like I deliver some workshops and people wanting to repeat it, but not for diseases that not necessarily the fun part of talking about it. But they wanted more because they wanted to educate themselves. We empower them just by using the method of building a bridge, using both language back and forth to build a concept around what should we be doing versus what their culture and language may be misaligned when it comes to this disease. And then empowerment happened within the group so they could actually act on it, which is what you want to see. You don't want to get dragged people through the journey of trying to understand why injury matters. This needs to be enabled, need to be lit within the communities. And this is where translation and interpreting is the best tool to build that connection. Thank you so much.
Thank you, Henrietta, for that presentation. Let me see if I can share my screen again. Now is the time to ask questions. If you have any questions, could you please put those in the chat box? There we go. So if no one has any questions, I guess that really shows how broad your topic is and how well you covered that. If nobody has any questions, it means you did a really
Look,
good job to explain yourself.
yeah, look, and again, when it comes to multicultural engagement, people are often hesitant or worried that they have to do every culture,
Mm.
every language. No, you don't. Just start with who you know.
Mm-hmm.
Honestly, just knowing who you are. It's just I find it so empowering to know where are my limits, where are my like what I can do, and then either build on that or acknowledge that to the communities so they can come to me and work together with me. I had numerous communities that came to me instead of me going to them because I just didn't had the connection or didn't had the experience with them. But again, it's just about making sure that you know who you want to engage and why, and know it for
Mm.
yourself. So
Yeah, oh, it looks like we've got one from Suzanne. How do you work with interpreters when these translational differences exist, e.g., for dementia or sexual health?
so it's a very good question. So NATE is actually doing a lot of training. So you can be reassured that a lot of the interpreters and translators are getting really good training on this as we speak. They are constantly improving on how they're interpreting and translation. This is why it's really important that you know as well your topic and have a little bit of debriefing of which communities you're going to work with or talk about. And because the reality is, especially the interpreters, they will have to translate to the best of their abilities, matching what you are saying. But if you're coming from, again, from that monolingual and monocultural understanding of some of these issues, you may just translating that monolingual and monocultural understanding to the community. So I would be just curious of having conversation if you can engage the interpreter before, as well as making sure that you are focusing on passing on, like to know the communities a little bit before. Again, translation and translators and interpreters are not your solutions. They are just part of that process of engaging with the communities. This is why being well prepared about the communities you're engaging with is so important. We do a lot of pre-engagement with communities. I ask community leaders of, so what's your experience with aging? You know, do you have any community members? So we can actually guide. So by the time we get to front of the communities, we have a quiet, good understanding of where they are at, so we can focus on that and talking to them about. So the interpreters don't let with the massive weight of trying to get this one right. It's really a working relationship of, well, we are learning here as well. Let's see how is this going. And you can always feedback if you felt like this was, they seem to be confusing. Interpreters are good with picking that one up so they can help you to reiterate or work around it. Translation, again, is really important that you have pre-engagement before you translate anything, because you just, especially if you're picking 10 languages, just picking 10 languages, translating it, and then printing it will not give, first of all, will not get to the communities. You don't know who is your target audience and what level of literacy they have. Office of Multicultural Interest have some really great guidance. So the Search Diversity WA app or website is really good at giving you a hint of at least where some of those diversity lies. And you can always reach out to us as well. We can have that conversation. I hope that answered the question.
Yep, that's great. And we have another one from Sue. Is there a tool available to alert us of common misinterpretations in our field?
Uh, Very good question. And this is one of the fights that's going on right now. We are trying to get a glossary for aged care. I know injury matters does not necessarily means just aged care. It's also disability and younger. It can be any age. I completely understand. But unfortunately, we are extremely segmented when it comes to our industry. So I only can talk about this particular section. We are looking at and hoping that we will have a glossary somewhat developed in the next couple of years where we can make sure that at least the interpreters know as well what to translate to, because yes, that definitely can be an issue. But as I said, the translators especially are getting really good. I just done a translating and sorry, that was for translators a month ago when we were discussing exactly this to make sure that what they're translating is meaningful. But the big problem is there is for their companies or bosses to engage with the client first, the organization requesting the translation, and to make sure that the organization knows what they want to talk about and to whom and why. So it's the translator doesn't have, again, that massive responsibility of getting it right. We should be all responsible for getting that message right.
Yep, that's great. And Sue did reply and say that is good news and will be
Yeah.
most useful. So I think that's all the questions. If anybody have any last minute questions, um, okay. I will just continue the presentation. Thank you for answering those questions and delivering such a amazing presentation. I really enjoyed hearing about the application side and how you did that with Dementia Australia. I'd now like to highlight the upcoming events that we have planned. On the 24th of June, we have the Preventing Falls and Building Communities, a local government approach webinar. This webinar will explore case studies of falls prevention programs that local governments have implemented in their community. On the 25th of June, we have our Active Balance for Falls Prevention workshop. This workshop focuses on the importance of balance in falls prevention and will explore recommended falls prevention exercise strategies and how to implement them. On the 8th of July, we have the Shared Vision Falls Prevention for Community Eye Health Practitioners webinar. This webinar will explore the role that eye care practitioners have in falls prevention. You can register and read more about these on our events page. We also offer a free self-paced online learning module. The Injury Prevention 101 e-learning online module provides an overview of injury in WA, the 5 stages of the public health approach to injury prevention, and WA's injury prevention activities. Connected is our online networking program for people working in the injury prevention and community safety sector in WA. If you'd like to join, you can use this QR code. And that brings us to the end of today's webinar. Thank you again for taking the time to tune into today's webinar and to Henrietta for sharing this information. Please connect with us. We're on various social channels. You can also sign up for our newsletter and our injury prevention network. Have a great afternoon.